Sciatica Therapy. Let's talk about what is done in a typical session for sciatica here at the clinic. So just to recap, this here would be a model of the bones of the lower back. So we see here the bones, and that's the discs. The disc themselves are made up of two main parts. You got the tough ring on the outside and the jelly in the center. And this here will be the spinal canal. This hole right here, and then the spinal cord is going to pass right through here. And then coming out of the side will be the nerves that exit the spinal canal that will then supply the legs as they move downward. Now, let's say you have an issue with the disc where it is bulging. In these two models here, we have some issues with the disc. Of course, this one here it's more severe, where the jelly-like center pushes out and it begins to go into the spinal canal. This one here is not as bad. There is some disc bulging, but it doesn't actually go into the spinal canal. Now, look at this disc over here. This disc here has bulge, and now it is pinching on the nerve. So this is one of the nerves that flows downward and will supply the legs. Now, if this nerve is impinged on or pinched, the leg is going to get symptoms: pain, tingling, numbness, and when it's really bad, then you get weakness in the leg. So this here would be the picture of sciatica. Sciatica would be a pinched nerve of the lower back. So in the treatment of sciatica, one of the methods or techniques that is employed would be massage therapy. Now, why massage therapy? Now, the back itself obviously is made of bones. Then you have the disc, but you also have ligaments and you have muscles that are obviously not seen on this model here. Now, if you have a disc that is bulging and pinching on a nerve, now if you employ massage therapy and you loosen the muscles, as you can imagine, when the muscles begin to lose some tension, you relax, the pressure on this nerve here due to this bulging disc will be less, and then you will have less symptoms. It obviously is not going to go away in one session, but then that will lead to a reduction in pain in a lot of the cases. Another part of the therapy would be exercise and stretching. So massage therapy would help to release the tension in the muscles. And now exercise and stretches, that also goes further in helping to decrease the pressure on the nerve due to the disc. So when you do exercise that cause the spine to flex and bend, or to flex and to extend, it helps to give back mobility to the spine. And what that can in turn do, in a lot of cases, it can reduce the pressure the nerve is experiencing due to the bulging disc. Same thing with stretches. So massage, exercises, and stretches will lead to a reduction in the muscular tension on the spinal column, and that will in turn lead to some reduction of pressure on this nerve here. With sciatica, that is a pinch nerve of the lower back. Now remember, the entire body is connected. If you're having sciatica, we also have to look at the neck and the upper back, because as you can imagine, if you have tight neck muscles or tight muscles in the middle back, it can in turn lead to increased pressure here or muscular tension in the lower back. When doing massage therapy for sciatica, it's not just going to be about the lower back. It also work needs to be done on the middle or the upper back, as well as the trapezius, as well as the neck muscles. And in that way, it will help to release as much tension along the spinal canal, leading to the most relief possible when it comes to massages, exercises, and stretches. Another method that can be employed in dealing with sciatica would be forms of electrical therapy, like the TENS or the EMS. Now, with the TENS electrical therapy, the theory upon which that works is in the manner in which you apply the electrical current, it helps to modify the pain signals, leaving the affected area reach the brain. So it sort of modifies the signal that the nerve is giving off and that the brain has to interpret. Now, when you modify that signal, the person can sense less pain. The EMS and TENS, there's a bit of a crossover. If you TENS on a very high voltage, leading to a lot of muscular contraction, that more or less would be also EMS. But EMS would be electrical muscular stimulation. When you have a muscle that is tight and then you begin to contract and relax that muscle for a while, what happens is that the muscle tends to lose muscular tension. It relaxes. So electrical therapy that helps to contract and relax the muscle multiple times can lead to a reduction in the muscular tension. Again, massage is one way in which to release muscular tension. EMS can also be used to reduce muscular tension, but of course using an electrical current. Red light therapy. Now, red light therapy, as well as near-infrared light therapy, can be used to help to loosen the muscles. In the same way which we're using massage therapy, electrical therapy, to help to loosen these tight muscles, to help to relieve the pain, red light therapy can also be used. So when a person comes in, the red light therapy would be applied across the back like this, and it can help to loosen the muscles of the back, the glutes, the hamstrings. And again too, this will be an adjunct to the massage therapy as well as the electrical therapy. Typically not really used as a standalone therapeutic modality, but rather used in conjunction with the other modalities. Now, let's say in a case where a person comes in and it's very severe sciatica, you can't even touch the person. What can be done? The person can do a red light therapy, maybe 20 minutes of red light therapy, help to loosen the muscles, relax the muscle, and then we can attempt to do massage and see if the person can tolerate the therapy. So that's another way in which red light therapy can be used. For this particular mat, we can actually we can adjust the intensity. Right now it's on the lowest intensity. Dry needling. So dry needling, what this technique is all about, I'm going to show you this here. This is one of the needles, one of the types of needles that will be used to treat sciatica. The needle is put into the muscle that is tight, and that also helps to relax the muscle. So let's go to open this one to show you. This is the needle inside of the tube. I'm going to remove it, and I'm going to show you what the needle is about. So this is one of the needles that can be put into the muscle. It's very thin, and you really don't feel it when the needle pierces the skin. You may get a sting or a burn or uncomfortable feeling as the needle enters the tight region of the muscle. Okay, so this is one of the needles that could potentially be used to relax the muscle when we are treating sciatica. Cupping. Okay, so cupping can be used as another way in which to relax tight muscles. So this here will be an example of a cup that would be used in the cupping therapy. So let's say you have a tight muscle. Of course, many of you would be familiar. You put the cup over the tight region of the muscle. In case of the back, you put it on the back here, and then you have a special vacuum gun that is going to suck air out of the cup, and that is going to cause the muscle to be, and the skin to be drawn into the cup. When you create a vacuum around the area, what's going to happen is it's going to draw more blood to that area. Capillaries are going to dilate, and then you're going to flood that tight region of the muscle with a lot more blood, and this can potentially lead to the muscle relaxing. One of the side effects of the cupping would be a red spot on the area where you apply the cup. This is where maybe some of the capillaries broke and you got some superficial bleeding under the skin, or some light bleeding under the skin. But this is not harmful. This goes away in about 2 weeks, depending on what level of suction was used in the cupping therapy. Okay, so this is again another way in which to help to relax the muscles. Inversion therapy. So this is where a person goes on an inversion table and the person is turned upside down. But in a lot of the cases, the person will not be turned all the way upside down. We will use a shallow angle initially, put the person on maybe for 5 minutes, just to see how they respond. And this uses gravity to help to stretch the spinal column, the muscles as well as the ligaments, helps to take some pressure off the nerve that is being pinched. Medication. Now, in terms of medication, the three main classes of medication that can be used to help to manage sciatica would be anti-inflammatory, such as diclofenac, muscle relaxant like baclofen, as well as another anti-inflammatory, steroid anti-inflammatory such as dexamethasone may be used. Opioids like tramadol. Tramadol typically is mixed with Gravol when it is given orally or as an injection. The reason you're mixing the tramadol with the Gravol is that one of the side effects of tramadol is to make you feel nauseous. So the Gravol is used to offset that side effect. Uncontrolled diabetes, uncontrolled high blood pressure, dexamethasone, which is a steroid, generally will not be given if your sugar is very uncontrolled or your sugar is or your blood pressure is not well controlled, as a steroid can cause a temporary surge in sugar and in pressure. Now these anti-inflammatories, some people may say, okay, well that's just masking the symptom. They want a treatment. Now, while I agree that in a way, yes, the medication are quote unquote masking the symptoms, they also do help with the treatment of sciatica. Supplements. Okay, so vitamin B supplements are helpful in the treatment of sciatica. So high amounts of the vitamin B1 and the B6 can help to protect the nerve, also help the nerve to heal. So I encourage people again to also take the vitamin B supplement while they are treating sciatica. Okay, so I hope you enjoyed that talk on the treatment of sciatica. If you have any questions or you want to book an appointment, you can call or WhatsApp 747-5297 or 308-3370. We are located at number 4 Chincuna Gardens, Chinchin Road in Cunupia.